Today we have Curtis Preston with us, and he has got information, latest information out of our guest about the virus, and so he's going to do his thing, and I'm going to get out of the way.
Pleasure to be with this group as always. For those of y'all that don't know me, my name is Curtis Preston. I'm an extension agent for disaster assistance and recovery with Texas A&M Agrilife Extension Service. I changed to this position back in mid-December. Really thought that I would be maybe working a wildfire or a hurricane before some kind of virus. But anyway, there is, we all know what's been going on the last, especially the last few days, the last couple of weeks. So lots of information out there. So I want to try to dispel some of the myths that's out there and give some good concrete data and information about the coronavirus. What is COVID-19? That's the acronym that you're using for the coronavirus. COVID-19 is a respiratory disease caused by a coronavirus called SARS-CoV-2. SARS-CoV-2 is a new strain of coronavirus that scientists first identified in December 2019. Because it is a new disease, humans have no built-in immunity to it. And scientists are still learning on how to treat it and refining ways to even diagnose it. Coronaviruses are common in humans and many animal species. For example, the common cold is caused by coronavirus. This is a rare occurrence that an animal coronavirus can infect a human, which is called a zoonotic disease. Even more rare is that the coronavirus gains the ability to spread from the infected person to other humans. So 2 rare events have occurred with this form of coronavirus. COVID-19 is, like we said, part of the family of coronaviruses ranging from the common cold to more serious diseases such as the Middle East respiratory syndrome. COVID-19 is not the same as flu. Seasonal flu is caused by a different virus called influenza A. The seasonal flu vaccine is effective in preventing many flu illnesses, but it does not protect against COVID-19. Similarly, prescription medications to treat the flu are not used to treat COVID-19. The first confirmed case of COVID-19 was in December 2019 in China. Symptoms. The most common symptom of COVID-19 are fever, cough, and shortness of breath. It's a respiratory illness. Usually, illness is mild in most people. Some infected persons will have no symptoms at all. The illness can be severe in specific groups of the population. Those who are considered at high risk of severe disease include older age groups, especially 80 and older. Individuals of any age who have underlying health conditions like lung disease, cardiac disease, hypertension, and diabetes. Symptoms of COVID-19 may be like those experienced with seasonal flu. So some people with seasonal flu could think they have COVID-19 and vice versa. With the severe disease, patients experience acute respiratory distress and develop pneumonia. How it spreads. SARS-CoV-2 is spread from person to person through respiratory droplets, which is the same way that seasonal flu is spread. The virus resides in the respiratory fluids that coat the respiratory tract, which includes the nose, mouth, throat, and lungs, and may reside in other mucous membranes, such as the eyes. Droplets of this fluid are produced through coughing and sneezing. When a person with COVID-19 coughs or sneezes, droplets containing the virus are sprayed throughout the surrounding air. Current understanding of this spread is largely based upon what is known with the other similar coronaviruses. Infection occurs when a droplet carrying the virus enters another person's mucous membrane. Mucous membranes include the respiratory tract, nose, mouth, throat, and lungs, but also the eyes. That's why we've been saying, don't wipe, don't use your hands to wipe or scratch your eyes. The droplet could be transmitted in this way through the air or could be shared through touching, such as an infected person coughs into his hand and then touches or shakes hands with someone who touches his eyes, nose, or mouth. Question: how many got out of their vehicles after touching their steering wheel, grabbed the door of the facility, went and grabbed your name tag, and went straight to the line to get your lunch without going to the restroom and washing your hands? I know, I'm not gonna, I know how many servants. So I'm guilty too. That's one of the ways we're trying to stop the spread, where it won't spread so fast. Because the droplets are affected by gravity, they eventually fall to the ground and usually within a few feet of the person who coughed or sneezed. Although this is not thought to be a significant source of COVID-19, there is some possibility that the virus can exist on surfaces and also spread that way. So this slide is actually, in the next one I believe, is basically out of date. There's more and more research daily. It has not been published, but there's data suggests that it exists longer on surfaces than what they first thought. So this is one of the things that scientists are learning, how it spreads. COVID-19 is a virus, which means antibiotics cannot be used to treat it. If you have severe COVID-19, your doctor may give you antibiotics to prevent bacterial infections that could develop as a result of severe COVID-19. Medications used to treat seasonal flu, example Tamiflu, does not work for COVID-19. Most mild cases can resolve on their own and may need no medical intervention. Severe cases may require hospitalization, even breathing assistance in treatment for pneumonia. Individuals experiencing shortness of breath are urged to contact their healthcare provider by telephone to discuss possible options. In the U.S., the CDC has developed a test and it is being provided to public health laboratories on an as-needed basis. And as we have seen over the last few days, that the testing capabilities in the state are increasing nearly by the hour, but for sure by the day. So let's talk about prevention. We all have the responsibility to help prevent and slow the spread of COVID-19 and the other flus. Prevention of COVID-19 relies on preventing respiratory droplets of an infected person from entering the mucous membrane of others. If every person follows all recommendations to prevent COVID-19 spread, the epidemic will come to an end more quickly. And that's what we're trying to do. We're trying to flatten the curve, the bell curve of the spread of the virus. So our hospitals and healthcare system does not get overwhelmed. For the people that needed. And that may be a short number or a small number, but we need to have the facilities available to treat them if we need to. So, these are, here's some personal, environmental, and community actions that can help prevent the spread of the virus. These are referred to as NPIs, non-pharmaceutical interventions. So the first picture on the slide, cover your mouth, nose with something, even if it's your arm, when you cough or sneeze. Clean, disinfect your area, whether it be at home or at work. Wash your hands. I did a demonstration last week for the senior center. And it's a real neat little setup that shows you think you're washing your hands very good, and a lot of people don't. Wash them for 20 seconds if possible. If you don't have soap and water, you can use a hand sanitizer, but it's got to be at least 60% alcohol based. But soap and water is the best. Then next, of course, keep your house clean and stay at home. If you're sick, stay at home. Stay at home for at least 24 hours after you no longer have a fever or signs of fever without using any fever reducing medicine. Cover your coughs and sneeze on tissue or in your sleeve. Of course, wash your hands for at least 20 seconds. Key times to wash: after you blow your nose, cough, or sneeze; after touching common public items, door handles, ATM machines, etc. Before, during, and after preparing food; before eating food; before and after caring for someone who is home sick with vomiting or diarrhea; before and after treating a cut and wound; after using the toilet; changing diapers or cleaning up a child who has used the toilet; blowing your nose, coughing, sneezing; touching an animal feed or animal waste; and any handling of pet food or pet treats; and then of course taking out garbage. Simple, nothing new, guidelines that we should be using in everyday life way before this. So these simple guidelines, take care of yourself. Disinfect surfaces and objects that are frequently touched. A list of EPA-approved products that are expected to be effective against COVID-19 is available at this EPA website. I can get that to you at the end when we're done if you need it. Or just a diluted common household bleach at a 10%, 1 to 10 ratio, or a 10% solution of bleach. Communities. Policies and strategies that might be recommended in locations where there is community spread of disease. That's been the hot topic the last week. Everything, all the cases in Texas have been traced back to travel. A few days ago, there was a case in Houston that feared to be community spread. So it's beginning to spread in communities. Social distancing. I like this one because I like my bubble. Whether it's flu season or not, I don't want anybody inside my bubble. So keep yourself in the bubble. They're recommending to do elbow bumps instead of handshakes. Just keep your distance from people. Don't come in close contact with one another. Whether it be workplaces or events, meetings, or etc. There's places that are beginning to close. Child care centers, schools, and etc. Are beginning to close. And then your local health department, in conjunction with the Texas Department of Human Services, will notify the public for the need of anything else, or in case there has been a declared pandemic. So here's some more facts from COVID from the Center for Disease Control. CDC. Will warm weather stop the outbreak of COVID-19? COVID-19 is occurring across a wide range of climates and environments. Other respiratory viruses survive in warm, humid months. Spread of some of the respiratory viruses are influenced more by our physiology in colder months than properties of the virus itself. It is not yet known whether weather and temperature impact the spread of COVID-19. So some other viruses like the common cold and flu spread more during cold weather months, but that does not mean it's impossible to become sick with these viruses during other months. This time it is not known whether COVID-19 will decrease when our weather gets warmer. All right, am I at risk for COVID-19 from a package of products shipping from China? That was one of the statements I made a while ago. This slide may be outdated by now. I'll go ahead and just go through it. There's still a lot unknown. They're trying to figure it out. The two other coronaviruses have emerged previously to cause severe illness in people, the MERS and the SARS. The virus that causes COVID-19 is more genetically related to SARS than it is to the MERS. Beta coronaviruses with their origin in bats. While we don't know for sure that this virus will behave the same way as SARS or MERS, we can use the information gained from these, both of these earlier coronaviruses to guide us as we go forward. In general, because of poor survivability on these coronaviruses on surfaces, there's likely a low-risk spread of products or packaging. That's one of the things there is data showing now that may or may not. So it's not published by CDC, so we can't promote that yet, but that's possibly one of the reasons why there's such a big outbreak when it does. It's very contagious and it may last longer on some items. So hopefully we'll know that pretty soon. So what is community spread? Community spread means people have been infected with the virus in an area through contact with others in their community, including some who are not sure how or where they became infected. This is different from travel-related disease, which is when a person becomes infected before returning from travel where they learn they are infected. CDC recommends the use of face masks to prevent it. The use of face masks is crucial for health workers and other people who are taking care of someone that's infected with COVID-19. CDC does not recommend that people who wear a face mask to protect themselves from respiratory illness, including COVID-19. So you should only wear a mask if you're a health professional or a health professional recommends it. Face masks should only be used by people who have COVID-19 and are showing symptoms once it's recommended by their professional. This is to protect others from the risk of getting infected. Should I get tested? If you feel sick, have a fever or cough, you may want to contact your healthcare professional, especially if you have difficulty breathing or have been in close contact with a person known to have COVID-19. Or if you live or recently traveled from an area where there's an ongoing spread. All of our healthcare professionals are working with the state public health department and CDC to be determined who needs to be tested for COVID-19. This situation is evolving daily and changes daily, like it even did over the weekend. So this is not to put fear in anyone. We should not fear at all, because fear won't just causes panic and chaos. We should just, here's facts, go by facts. The CDC, the Department of State Health and Human Services, dshs.texas.gov, cdc.gov, and texashealth.tamu.edu is one of our websites. All three of these places have tons of information that's factual, that's got lots of handouts on how to do different things and how to take care of yourself. And then if you're really interested in it, you can get on and get email updates from CDC. So we just urge everyone to take care of themselves. It's not to panic. It has evolved, evolving daily, and things have changed tremendously the last week. So we just ask you to take care of yourself. You know, I'm sure not worried, but I don't want my mom to get it. I think a lot of you in here have elderly parents, so that's part of the group that we don't want to get it. And we want to slow the spread to where we have our healthcare system take care of everybody of the ones that actually need it. You know, the percentage looks small right now versus the flu, the people that die from the flu every year. But this thing can rise so rapidly, it just will tax the healthcare system, and that's what we're trying to prevent. So just follow the recommendations of our government and our CDC and the state health department. As you know, yesterday the president come out and suggested a group no more than 10 meet. That has not been at this time put on the CDC website. It still has 50 people as the magic number. But I think I read a tweet, actually, a superintendent from Texas tweeted over the weekend, and I thought it was a very good statement. And he said, we'll never know if we overreacted. Because a lot of people think the government's overreacting. But we will know for sure if we don't act enough. If we don't do enough, we'll know for sure. So just say you take care of yourself, take care of the ones around you. I don't want to be the one to spread it to somebody that's going to give it to an elderly person. Let me know. So I guess I can try to answer a few questions if you have any. As of now, we've met this morning as a county and city, and we're just doing day by day. The EMS and the police force is all on alert and taking care of themselves. And there's not been any declaration or anything as far as the city and county at this time. As far as we know, there's people been tested. There's nothing tested positive in a wide range. I guess the closest that I've heard has been the couple from Abilene. I think Santa Fe and Albuquerque's going that direction. So there's 57 cases as of this morning, or that has been updated, in 7 counties, I believe, in the state. So it's staying pretty settled as we speak. But we all know at some point it's going to get here. So, yes, sir.
Supposedly they had a guy over here at Littlefield that went through the prison or whatever and then went back to New Mexico or where he's from. Do they know where he's at?
Yes. Now they believe, as of this morning, that he might have contacted it or contracted it after he left Littlefield. But them 19 people that he was in contact at Littlefield, they're, I guess, has been tested and probably quarantined. So that's not, none of them have been released as positive or anything. So lots of talk. Just make sure you know the facts. And so now you know, we're under, after the president and the state, the governor does declarations, disaster declarations, control goes local for the most part. So the mayor and the county judge has, I guess, final authority if they want to shut everybody down. And I think we've got 2 good ones, but now we go back. We got an election coming up, And this has nothing to do with that, I know. But that's why it's important on who you put in office, from down here all the way up. And kind of side note, I come across it, and I don't think it was an accident. I've been at home, I've been in reading Hebrews for a good while now, in his last chapter, kind of in the middle of the chapter, and it says, obey your rulers and be submissive, for they look after your welfare. Depends on what translation, but they look after your soul is what translation I looked at, which is your mind, will, and emotion. So they look after us. So, and I'm not saying you can just go be in a group of 10, but let's not be defiant to who we've placed over us. So, and that's why it's important that you put in there. Sorry, that was free.
I visited with Dr. Richard yesterday morning, and at the time he said he was planning on school going on as normal starting next week, but that was before the announcement from the president. Has anything changed that you know of?
Schools are one of the exemptions from that the president said. There is daily conversation with TEA, and then we're gonna meet Thursday evening and decide, as of now, if it stays the same, and we don't have a case, what I call fairly locally, we plan on having school Monday, and just take it day at a time. UIL come out at 4 or 5 o'clock Friday evening, and they'd shut down all the games and track meets and all that. Now they've got no extracurricular practice after school of any kind. So at 4 o'clock, kids gotta be gone. So that's what we plan on as today. Just moving on forward. Now, if something breaks, then we'll look at it.
I have a question.
Yes, ma'am.
Mine's more directed to Dennis. Do we have any restrictions at the hospital or the clinics that we should know of?
Yes. And there, just for reference, so you can go back and look, it is posted on our Facebook page. So, but yes, we have visitor restrictions at the hospital now, as mandated by the state. And so, basically, nobody's coming in or out, unless you have, unless you've been assessed and screened before you come in. We are limiting visits to one person per patient, as designated by that patient. So, and then of course the nursing home is on really full lockdown. We're also assessing each of our employees daily, and we've got a whole system. Today we've got green dots, being St. Patty's Day. But we've got green dots on our name badges that indicate that we've been assessed and that we can come in and out. EMS, police, all of them will be assessed before they come in as well. Except in the case of a true emergency, we're not going to say, wait, stop, we got to take your temperature before you come in. So,
How come all the people are standing outside Dr. Purdy's office?
Why they're still standing out there, I do not have a clue.
Dr. Purdy has instituted a plan where they can have like 4 patients in the waiting room at 4 corners
Right.
of the room, trying to keep people spread out.
That's exactly right, but why they're standing outside, I don't know.
They're waiting for their turn to go in, I think.
But it's a set appointment. I mean, it's a set appointment, so they know that they can't come in till 8
I'm just telling you what he told me last night.
Last night, yeah, when you guys met, yeah, because we had discussed that as well, but Dr. Purdy is no longer taking walk-in patients. And so, yeah, and so if you need to be seen, you need to call the clinic of your choice, talk to them, say this is what I need to come in for. And then all entrance is coming in through the front main entrance, and that's where everybody will be assessed when they're coming in. Now, if you're coming in because you have a cold, you're going to likely be running fever, but you haven't been exposed, you haven't done this, you haven't done that. We realize that, we'll take you around, you'll go to the clinic. You know, of course, Dr. Purdy's is over there, so they're not coming in through the main entrance, but they are being assessed as they come in as well.
So what happens if you decide that they're at risk? You gonna send them home? You gonna see them in the ER? Or you gonna tell them to go to some private deal and not let them enter the hospital?
So yes to all the above. It's going to be on a case-by-case basis. There's not a one answer fits all. And so each person is going to be assessed to determine what is the best thing. Now, if we find out, yes, they have been exposed, or yes, they think they've had direct contact with the corona patient, if they're running a fever, if they've been into one of the designated areas as outlined by CDC, they've got, anyway, if they've been, and they're exhibiting symptoms of shortness of breath, we will be bringing them in. Now, we're going to do different protocol for inmates. Inmates are going to be taken over to Dr. McClanahan, Dr. Sheets' old clinic, and we'll have them quarantined there because the jails here don't have reverse isolation. And so we're going to take them over to that other clinic and have them quarantined over there. What we will be doing is if just somebody off the street comes in, feels like they have, and they say yes and yes and yes, then what we will do is test them for flu A, we'll test them for flu B, we'll test them for strep to see if that's the cause of their infection. If one of those come back positive, the likelihood of them being also infected with coronavirus is less likely. It doesn't mean it's an automatic negative. If all those do come back negative, then the possibility of them being infected with coronavirus is greater. And then they will be transported to a facility that has a reverse isolation, negative pressure rooms, so that they can properly be taken care of. That's it in a nutshell.
Dennis,
Yes.
I'm kind of isolated back there in my little office. Do you think, do you have any restrictions for that building?
Wash your hands.
Okay,
There you go.
okay.
I mean, seriously, wash your hands and don't pick your
Yeah.
nose. Don't
Well,
get there in the
yeah,
office by yourself
And I
and
don't
pick your
have very
nose.
many visitors over there.
Right. So, I mean, that's the thing, you know, we've just got to practice that good hygiene, you know, like this presentation that he just gave was great. I mean, we've got to do those things to protect ourselves.
Can I ask Shawnee for some disinfectant or not?
No.
No, okay.
I
Bring
mean,
my own?
Yeah,
Okay.
yeah, I mean, honestly,
That's my
we're just
problem.
being, yeah, we're really being very protective of that.
Okay.
We're using it in the places that absolutely positively
You're
need to
not
be,
having,
yeah.
you're not having any training in that building at this time?
No,
Okay.
not that I'm aware of. EMS might have something scheduled, but, you know, even EMS for their paramedics and, you know, they do rotations and stuff, those have all been canceled as well.
Okay.
So, you know, just to reduce the number of people coming in and out of the facility.
That's good. Thank you.
Does anybody have any other questions?
Why the big run on toilet paper?
So here's the ironic answer to that. The majority of toilet paper is manufactured in China. China said, we're shutting down factories, we're sending people home, they're quarantining themselves, and so those factories aren't producing it. And so the scare is, oh, if they're not going to produce it, then there's not going to be any available. And then it just caught on like wildfire.
Call them like toilet paper.
Yeah.
Well, according to the Wall Street Journal this morning, Kimberly Clark makes a whole bunch here now too, and they're
Oh, yeah,
saying,
they
they're
do.
saying we got it, and the
Yeah.
problem is getting it to everybody, you know, to have your enough in the store or whatever, but as far as having enough, in general, they're gonna have enough, they said.
Could be an opportunity.
Yeah.
American company coming back.
Yeah, and then if anybody needs any, I've got a lot of toilet paper on my wall right behind me.
As of right now, there's been no confirmed shortages of anything, including drugs, at the moment. Yeah, it is just getting it to where it needs to be. Drivers, you know, when you're main outgoing is water, cleaning supplies, and toilet paper. It's kind of hard to ship everything else you need in the same truck, as well as, you know, get it from a distribution center to where it needs to be in a timely manner. I believe we do have a truck coming into United today, but I don't know exactly what's all on it.
What time?
Will be, it will come in under the cloak of darkness.
We'll help unload the truck.
Because of Christian charity, if you come to our place at church, you can use all the toilet paper you can use while you're there, but we're checking your shoes when you do it.
So, yeah, I've heard anywhere between people at FedEx getting stopped asking them for wipes to, you know, seeing a Walmart truck drive by with like 2 other people following up. I don't have individual numbers. I know Curtis said there's somewhere around 57 in the state of Texas. Number according, I guess, actively updated as of 12 o'clock midnight GMT. USA has around 5,700 cases that are active at the moment. That's up 1,000 from yesterday. And that number was up again 800 from yesterday before.
So that's a reverse of the stock market, right?
Only 97 actually total deaths, which was an increase of 11 from that, and total active cases, I believe, are around, total active, I guess, non-bad cases around 5,500. So, I mean, majority of the ones that are super serious is 12. So, but the death percentage has increased per total million population is 17.2, which I'm not entirely sure what the percentage is on that. And with those numbers being said, I'd like to move to, I guess, postpone meetings at least for the next 2 weeks. Y'all can continue to have them, but I will not be present due to my active participation with the, I guess, public on a day-by-day manner.